Admission to the Singapore General Hospital is now faster thanks to a new bed management system. The system, in place since last year, tracks the admission and discharge information of patients so that beds can be made available sooner, and it has cut the time taken to get a bed from 15 to just 5 minutes. SGH, which has 1,500 beds, hopes to ease the crunch further with the system in place.
Using this radio frequency identification or RFID tag, the hospital staff will be able to keep tabs on where a newly admitted patient is. More importantly, they'll be able to search for and allocate a bed that's most suitable for the patient.
If you want to compare 10 years ago until now, I think now is the best service. I think very fast, about 5 minutes.
Bed management has always been a key challenge hospitals face. With the new system, instead of having to manually update books and whiteboards, hospital staff can refer to these display screens here to get real-time patient information, such as their location as well as the admission and discharge status.
When we have occupancy of 85 or 90 or 95%, the nurses are pretty busy. Now with this system, it allows us to automatically discharge the patient, automatically call for the cleaners to come to clean the beds, and then also automatically, actually it concludes the patient's episode in the hospital, and it actually sends the bill automatically to our system.
Implemented in May last year, the $3 million system cuts turnaround time from when a patient is discharged to having the bed ready from 90 minutes to just 50 minutes. So on a bad day, patients who once had to wait up to 10 hours to get admitted from the emergency department can now get in within 2 hours.
Now, the new National Centre for Infectious Diseases will come armed with a system that tracks people in its compound. It will make contact tracing easier, faster and more accurate during a disease outbreak.
That's the alert that will go off on this tag worn by healthcare staff whenever they forget to sanitize their hands. The technology uses pressure sensors under the hand sanitizers to trigger reminders, and the tag will keep beeping until the hand hygiene procedure is completed. This is one feature of the real-time location system, which will be rolled out at the National Centre for Infectious Diseases by the end of the year. Crucially, the system tracks the movements of people at the centre, including who they have come into contact with, where, and for how long. During a disease outbreak, it could mean the difference between life and death.
Everyone who enters into NCID wears this tag.
All patients and staff within NCID wear a real-time tracking device, which allows the staff surveillance team to quickly trace people who were in contact with the porter.
You can just open up all of them so you can actually see all of them have been in contact with every other people.
It provides granular level of visibility of where each patient is and where each staff is.
So this is the floor plan. It shows this porter's movement history on this date.
The information helps NCID to identify staff at risk of contracting the virus and to quarantine them to stem a potential hospital cluster.
You could say this is Big Brother watching you, but just say this is a friendly father, hospital observing people, again for staff safety.
This is the screening center, so a lot of movement happening in screening.
And date of the transaction. SADO has the software support capability to work with any blood software solution provider to interface PJM into their systems, enabling real-time inventory visibility, automated temperature and location tracking, first expiry first out enforcement, as well as many other benefits.